So we may start. Good evening, everyone, and Assalamu alaikum, and a very warm welcome to you all. I'm MD Faisal Ahmed, and it's truly a pleasure to be your host for this special session organized by the Bangladesh Institute of Innovative Health Research, or BIIHR. Thank you so much for taking the time to join us today for our international webinar titled Bridging Research and Policy, a practical introduction to health systems for early career researchers. We are incredibly excited to have participants from diverse academic and professional backgrounds with us today, and we are even more excited about the conversation we are about to have. Before we dive into this main session, allow me to share a little bit about BIIHR, the organization behind this event. BIIHR is a non-profit, student-led, and fully virtual research organization that began its journey on 23rd November 2023. Our mission is simple: to build and support research capacity among undergraduate and early career researchers, especially in low-resource settings like ours. Today, more than 30 university students are actively contributing as research assistants across our two dedicated research departments. In addition, over 10 students are working behind the scenes in the managerial and operational aspects of the institution. So far, BIIHR has co-authored 10 peer-reviewed journal papers, presented 5 conference papers, and has 6 papers currently under review, and 4 more manuscripts in progress. All of these has been made possible thanks to the dedication of our student team and the generous support of mentors and supports who believe in our vision. And speaking of mentors, it's now my honor to introduce someone whose work has inspired many of us in this field. Our keynote speaker for today is Dr. Tawfiq Jordar sir, a globally respected expert in health systems and policy research. Dr. Jordar is Associate Professor and Lead of the Program Evaluation Unit at the SyncHealth Duke NUS Global Health Institute and Vice Chairperson of the Public Health Foundation Bangladesh. He brings years of experience in shaping policy, leading impactful research, and mentoring emerging scholars, both in Bangladesh and internationally. We are truly grateful to have him with us today to share insights that are not only grounded in theory but shaped by real world policy engagements. In today's session, we will explore many aspects of health systems and policy research, which will be delivered by our honorable speaker, Dr. Tawfiq Jordar sir. Before we begin, just a few quick housekeeping notes for our participants. Please keep up your microphone muted throughout the session unless you are invited to speak. If you have questions, feel free to type them in the chat box. We will take them during the Q&A session toward the end. The session is being recorded and it will be shared later for educational purposes. With that, let's get started. Please join me in welcoming our esteemed keynote speaker, Dr. Tawfiq Jordar sir. Sir, we are truly honored to have you with us. The floor is yours, sir.
Thank you so much. I'm really honored to be invited by the early career researchers, where I had been perhaps a few years ago. And just like you, I had to go through the pains of uncertainty, the pains of not knowing what's best for me, because the future was unknown at that time. So I understand your, perhaps, at least I try to understand the issues that you might be interested in. I will try to um, kind of adjust my presentation or my discussions around that. So I mean, I have already been introduced quite generously. I mean, my name is Tawfiq Jordar. I worked in Bangladesh for a very long time, almost perhaps 14 years, 13 to 14 years. Although within these 14 years, 4 years were spent in Johns Hopkins University, where I did my PhD. more specifically DRPH actually, on health policy and systems research, um, basically on human resources for health, but more on that later. So today I'll be talking on health policy research or health systems research, or basic understanding of the health systems for early career researchers. So it's basically very basic understanding of health systems, because we have a very different types of understanding of the health systems, primarily due to our education. Sometimes we don't know what a health systems is. Secondly, it's a relatively new form, new field. The field evolved during 1970s to 1980s. In 1970s, um, there was this health service research, which is more into providing health services, providing health care. But around 1980s, I mean, people started thinking that healthcare is not just about providing care. There are many complex issues related to the care, or there are complex issues which impact the care delivery itself, especially in a low and middle income country. You know, so they started connecting the dots. They started realizing that it's not just about providing care. There are human resource issues, there are management issues, there are leadership issues, there are health information related issues. So it's not just about giving the care. There are so many different aspects to healthcare that are interrelated, and just one one of these components can hinder proper service delivery. There are many issues that are not even care delivery, but it has some ramification on the care. So with that understanding, around 1990s, people started thinking beyond just health care service delivery. And that's the time actually when the field of health policy and systems research came into existence, or started emerging. In 1993, there was a seminal report from the World Bank called the Investing in Health. In that report, they talked about different issues related to health, especially how you can be health can be cost effective, how health is not just about not just about the spending, is basically an investment. That's the concept that drove the field of health system. So previously, the concept was that or the understanding was that health is basically an expenditure. But now people started realizing that health is not just an expenditure. It's an investment, because if you invest on people's health, they will eventually serve the country, serve the economy better, and eventually it will create a virtuous cycle. Okay, so it's not just a spending; it's an investment. In 1996, the WHO created an ad hoc committee on health policy and systems development, and that committee led to development of a separate organization or separate unit within the World Health Organization. This unit was called Alliance for Health Policy and Systems Research, or in short, HPSR, Alliance for Health Policy and Systems Research. This committee, this unit is still existing, and it's working quite actively within the World Health Organization. In 2000, the year 2000 is very, very important in the field of health policy and systems research, because in that year, WHO published its seminal publication, seminal World Health Report on health systems. Or health systems improving the performance. And in this report, they proposed a framework of health systems, although they did not clearly mention the 6 building blocks per se, which came much later, but there was some sort of understanding. And interestingly, they say that there are 3 objectives of health systems. One is, of course, improving the health. Secondly, protecting people from financial burden for seeking care. And third, ensuring the responsiveness of the care, responsiveness of the care. Okay, uh, just a minute. Can you please wait for a minute? আচ্ছা একটু কি তোমরা একটু চিৎকার কম করবে বা একটু দরজাটা বন্ধ করবে প্লিজ? আমি খুব ডিস্ট্রাক্টেড হচ্ছি, প্লিজ একটু দরজাটা একটু বন্ধ করো, দরজাটা একটু বন্ধ করো প্লিজ। আইয়ান বাবা একটু দরজাটা বন্ধ করো বাবা, আমি কথা বলতে পারছি না, আই এম গেটিং ডিস্ট্রাক্টেড। Yeah, sorry, my son was actually talking. Yeah, so um, in 2000, they published this report, and they came up with a kind of um, a framework, okay, a framework for understanding health systems. And roughly that time is roughly considered as the initiation or the starting of the field of health policy and systems research. In 2004, there was a ministerial summit in Mexico. In 2008, there was a review of that meeting or an extension of that meeting in Bamako, Mali, which gave rise to this Bamako initiative. And in all of these conferences in 2004 and 2008, they discussed quite widely about investing in health systems as a whole. Previously, most of the investments were on particular diseases, tuberculosis, malaria, and so on and so forth. But now they say that okay, we now know what a health system is, what are the components of health system, and so why not investing in health system as a whole so that we can strengthen the health systems? So you see, there is actually we are gradually developing a field of health systems or health policy and systems. In 2010, there was a global conference. I was part of that conference actually. My boss was Tim Evans, who came to Bangladesh to lead the James P. Grant School of Public Health at BRAC University, and I was working there at that time. And he came from WHO. He was the ADG of WHO at that time. He resigned. I mean, he finished his job in WHO, came to Bangladesh. He had some role in the NGO called BRAC. Also, he was part of the ICDDRB. So he had multiple hats, but his main work was at James P. Grant School of Public Health, where I was working. And from there, he actually organized this conference called the first Global Symposium on Health Systems Research in Montreux, Switzerland. So actually, my growth as a professional is kind of aligned with the growth of the field of health policy and systems, because I mean, this conference marked, an important milestone in the history of global health policy and health systems, because all the people who are working on health policy and health systems, they came to Montreux, Switzerland, and luckily I was there as well. In 2012, WHO published a report, a strategy on health policy and health systems, which I'll show in my next slide. But that was the first WHO publication particularly focusing on health policy and health systems. 2012 is also important because that's the year when a body of health policy and systems research, a group of health policy and systems research actually came into existence. It's called Health Systems Global. Okay, and they organized their second symposium, global symposium. If you remember, the first one was in 2010 in Montreux, Switzerland. The second one was in Beijing. I joined that as well. And in that conference, they started this Health Systems Global, which is the global professional body of the health policy and systems researchers, which
Sorry to interrupt you, sir.
yeah.
The slides are not moving.
Oh no, I didn't
I can
change
move,
it.
sir.
I did not change my slide
Okay, sir.
yet. Yeah. So this in 2000. So the Health Systems Global was established, and I'm now a board member of the Health Systems Global since 2022, I believe. Yeah, since 2022, I'm a board member of the Health Systems Global. So if you are interested in health systems work or gaining a better understanding in health systems, or willing to work in health systems, since many of you are early career researchers, you can become either a member of the Health Systems Global, just Google it, or there are around 10 thematic working groups within Health Systems Global, which you become member of. For that, you don't need a membership. Okay, you don't need to pay anything. You can just network with the like-minded people. So these 10 thematic working groups are on different topics, on climate change, on planetary health, on gender, on community health workers, on what else? I mean, on implementation research. So different topics are there. So if you are interested in a particular topic, you can become a member of one. I mean, you can just sign in to any of these groups and develop your network. So it's a good source for emerging health policy and systems research people. And in 2024, we just finished the 8th Global Symposium in Health Systems Research in Nagasaki, which I was part of the organizing committee. So this is the first report. I hope you can see the change now, right? I changed the slide. Can you see it?
Still not changed, sir.
It's still not changed?
No, sir.
Strange.
Now it's moving.
But it's not I mean, it's not full screen now. Can you see changing mindset?
Yes, sir.
Can you see the next slide?
No, it's
So if
changing mindset slides.
okay, I don't know what's happening there, but I'm changing the slides, but it's not getting changed. So that's one of the reasons I usually struggle when presenting on Google Meets. But let me see if I can do anything there. Can I do anything there? Slideshow, yeah, maybe. Present by speaker, browse by an individual window. Um, browse an initial one.
Maybe, sir, you can share it from current slide option.
Sorry, which one?
Uh, from current slide option. It's on the left side.
Yeah. Can you see the changing mindset, right? You see the changing mindset slide, right?
Yes, sir.
Do you see the next slide now? I changed it. What is HPSR?
No, sir.
What do you see now? Do you see any other
Changing
thing?
mindset slide.
It's still changing mindset. Okay.
Yes, sir.
So that means for some reason my slide is not changing on your end. Yeah. So that's a problem.
Maybe you can just start from the beginning again and just go back. Maybe to change them like from beginning and then start again.
Okay, I went to the beginning. Can you see the beginning slide?
No, it's still changing mindsets.
But I'm actually seeing the first slide, the title slide.
We can see the changing minds. Now it's changed. Now, just now.
Okay,
Yeah.
let me share again. Okay, let me share it again. What do you see now?
First slide, sir.
Do you see the next slide?
Steel stack, sir.
No change.
Yeah.
No change.
Yes, sir. It's still the first slide.
So I don't know what's happening here. So
Now
maybe.
we can see the third slide, changing mindsets.
So I think for whatever reason the full screen is not working. Which is very annoying. But let me see if I can think of anything else. What do you see now?
Now it's presenting changing mindset slide.
Yeah, now it's full screen.
Now it's moving, sir.
Now it is moving, right? Okay,
Yes, sir.
got it. All right, I got it. Okay, all right. So changing mindsets. So this is the report that that was published in 2012. I mentioned about it. It's basically WHO's first report on health policy and systems research, and they kind of try to clarify the characteristics of health policy and systems research. They compared health policy and systems research, or the field of health policy and systems research. They compared it with the GPS system. Okay, so in a GPS, what happens? I mean, you have a starting point. You tell him where you want to go, and then it shows you how you get there. So health systems research, or health policy and systems research, also provide a navigational support to the decision makers. Okay, it helps them to locate the starting point of the journey, like what's the health problem. So where you start the journey, where there is a problem. So that's where a health systems researcher actually works to solve the problem. Now you tell him the desired destination, that is the health outcome or the outcome you want to achieve. So it helps you to determine what outcomes you really need to address as part of the health system. What are the important outcomes, okay? And also the options for getting there. It tells you the options, how you can get there. Is it cost effective? Is it is not? Is it going to make bigger problems for you? So a lot of discussions are happening on reform, on health systems reform, health sector reform, or whatever, So it's very relevant to understand the reform and to understand how the reform actually works. It's a very lengthy and convoluted process. And if you want to change one thing, it's not just changing one thing, because if you want to change one element, it's linked to many other elements which will also change. That's a very basic understanding of any reform. So reform is not as simple as people often think. It's a very, very complex thing. So making one simple change may actually have a very, very catastrophic consequence. Sometimes it may not, but as health policy and systems researcher, we need to actually understand the consequences as well. So what is health policy and systems research? Health policy and systems research seeks to understand and improve how societies organize themselves in achieving collective health goals, and how different actors interact in the policy and implementation processes to contribute to the policy outcome. Okay, by nature it is interdisciplinary. So some people may think that health system is just about doctors, maybe. Okay, but that's not true. We saw during our COVID-19 pandemic, we saw the government formed a 26-member technical advisory group, and maybe among these 12 people, 8 or 9 people were actually clinicians, gynecologists, psychiatrists, and whatnot. But you need to understand a health systems approach requires a multidisciplinary and interdisciplinary approach with a blend of economists, sociologists, anthropologists, political scientists, public health experts, epidemiologists, and many other relevant fields. So that's also one important understanding of health systems, that is very much interdisciplinary. It's not just about doctors, it's not just about nurses, it's not just about one particular field, but rather it is distinguished by issues and questions, not by the professional groups. So this is actually a very common thing, that the professional groups consider themselves as, what should I say, like the leader of the health profession. But in health, I mean, if you have a health policy and systems research lens, you will understand that it doesn't matter who is leading. He's a doctor or not, he's a nurse, he's a biochemist, it doesn't matter. So you need to understand what your research question is, what your questions are, and who can solve that problem, who can answer that question. Okay, that's what that we all worry about or all emphasize on. So research focused on health services as well as promotion of health. There are concerns for global and international issues as well as national and subnational issues. So, for example, there is a tariff in WH imposed by USA, or there is a fund cut to WHO. There is sudden defunding of the USAID after Donald Trump came to power, right? All of these have very, very massive, important ramifications or effects on our health system. So health system is not just about national or subnational. It's not just about Bangladesh and the 8 divisions of Bangladesh. Rather, I mean, if you are studying health policy and health systems, you need to be very concerned, very cautious, very much well informed about global and international developments, because those are related to your work in local level. Research on or off policy. So research should be on policy, or it should be research about the policy to address the politics of health system and health services. So political science is very important. I did several policy analysis when I was in Bangladesh. I'm doing one in Singapore as well. And it's very challenging because people often do not want to talk to you because they feel that there are secrecy acts. If they say something which they should not say, they will lose their power, they lose their job, and so on and so forth. So it's a tricky field, but it's about health policy and systems research. This field promotes work that explicitly seeks to influence policy. So that's another basic understanding of health policy and systems research. So it's not just about understanding, it's also about influencing the policy. So it's not just understanding something, it's about how you make the change in the health policy. What are the goals? The goals are both research on describing a system, that is how a system works, and research on changing the system, what I just said in my previous slide, end of my previous slide. So how can you change it? How to change it? You know, these are the issues that you need to consider also. So HPSR means health policy and systems research. So HPSR seeks to understand what health systems are and how they operate. It also seeks to understand what need to be done to strengthen the health systems in order to improve the performance in terms of health gain and other social values. So this is basically an evaluation of how can I show? Okay. How to do it. But anyways, so evaluation of the current system performance and the policies, interventions intended to improve the health system performance. So it has an evaluative aspect, like evaluation of the current systems and how it is, I mean, how the systems are running. So we need to understand, assess, and work on it. At the same time, the research or health policy and systems research seeks to understand how to influence the policy agendas to embrace the action to strengthen the health system. So it's about influencing and understanding and developing the policy as well. Okay, so what I'm saying is that it's just not about health system, it's about health system and health policy. And also it's not just about understanding the health systems or health policy, it's all about understanding how to change the health system and health policy as well. So this field is very activist driven, you know, it's not passive, it's a very, very active discipline, it's a very active field. So these are the scopes, this is the scope of health policy and systems research. On left side you see the health systems, and on the right side you see health policy. And it can happen at the global, it can happen at the national level, and it can happen at a small level too. So we will see the levels of the health policy and systems research in maybe next slide or in few slides down the line. So what is health system? I mean, when we say, I mean, the scope of the health policy and systems research is health systems. By that we mean there are both hardware elements of a health system and there are software elements of the health systems. In the hardware, we try to do research on the structure, organization, technology, and resources, things that you can see, things that you can touch, things that you can intervene on. Okay, so these are the hardware. These are very tangible. But there are some software issues too, and these are, I mean, you cannot really see them, you cannot just touch them. Okay, so there are some structures, there are some processes, for example, efficiency, how something happens, how things are negotiated, how the system functions. You cannot touch a system, you cannot see a system, you can only imagine it, you can only describe it by some jargons or some technical terms. But there are some intangible elements to health systems too, especially the software elements like relationship. You cannot see a relationship. It's very difficult to measure, but relationships are important. The relationship between doctor and patient, for example, or the relationship between a doctor and his boss, which may or may not be a doctor. I have seen midwives now working in some sub-district level hospital, upazila level hospitals, upazila health complexes, but their boss is actually a nurse, and the nurses may not clearly 100% understand the needs of a midwife. Okay, possible technically, I mean conceptually, there is a possibility. So there are communication issues, there are values and norms. There could be a society where people may think that, okay, I want to just make money. For example, in the US, the health system is very much profit driven, where in many other countries, it's not really profit driven venture. It's very public health driven venture in many other countries. In Japan, for example, in several other countries, in Canada, for example, in Netherlands, in UK. Okay, so there are some values and norms that you need to understand if you want to understand a health system. In terms of health policy, you need to understand the content and instruments, but that's not enough. So what is a content or an instrument? For example, health policy or adolescent policy or nutrition policy is written on a paper, right? But that's not enough. Just reading that paper will not tell you much, because a lot of things are on paper, but it doesn't get implemented. Why? Because there are power relations, there are politics, there are some actors who may not really want you to work. There could be very strong private healthcare providers who may not want certain policies to be implemented, because that will decrease their business, or that will harm their business, right? So these actors are important. Power and politics are important. There are institutions, interests, and ideas that you need to understand why a policy works or doesn't work. I have numerous such examples, but maybe we can discuss this later. Please remind me when I need to stop, because I can actually carry on for a very long time. Okay, so is the time till your 9 p.m.?
Sorry, you can carry on how much you can want.
No, I need to stop too, but what's your time limit in general? I mean, what's your formal duration of this keynote presentation?
1.5 hours.
1.5. Okay, all right. Yeah. Hopefully I won't need 1.5 hours. But anyways, so I talked about what a health policy and systems research is, but you need to also understand what a health policy and systems research is not. It's not a clinical or basic science research. It's not a biochemical research, for example. You know, some people may jump into, oh, I see health, so maybe it's about clinical research. Okay, no, it's not a clinical research. HPSR is not only rooted in health economics or focused on financing issues. Some people still have this understanding. Oh, it's a health systems, health policy. So perhaps you're talking about some macroeconomic policy that's part of it, right? No, that's also not the case. Although economics plays a very important part, we do health economics research, but that's not the whole health policy and systems research. Okay, it's beyond that. Um, it's not focused on a particular disease distribution, which epidemiology is. Okay, so it's not an epidemiological field, or causes and interventions. Again, these are not epidemiological issues that we are interested in HPSR, but rather generic organizational and societal structures through which interventions are implemented. This is what we are rather interested in. This diagram shows you, for example, the intersection of different fields and how what is actually health policy and systems research. On the left, you see sub-individual level issues. Clearly, is not health policy and systems research. For example, biomedical research. Then there are some individual level issues, for example, clinical and behavioral research. So it can have, I mean, some clinical research may have some policy relevance or health systems research relevance. So these two circles are actually our circle of interest. This, I don't know, is it pink or no, it's actually magenta or what? It's indigo or whatever. So this small circle, this is about health policy research, and this blue circle, which is a health systems research. So these two combined are called health policy and systems research, and clinical and behavioral research have some overlap. Not all. There, I mean, a large portion of it is actually not part of the health policy and systems research, but there are some overlaps. Then population health research also has some overlap, but population health research, by just by definition, cannot fall under health policy and systems research. So some of these research can be health policy and systems research, some may not. So just because something is a population health research doesn't mean it's health policy and systems research. Health policy and systems research also, especially health systems research part of the health policy and systems research, can be broken down into three groups, like micro, meso, and macro. So micro levels are, I'll discuss it in the next slide too, but just in short, micro level topics are related to individuals. Meso level topics are mostly related to the institutions, for example, a hospital. But macro level issues are beyond that. It can be related to Ministry of Health. It could be something related to how Ministry of Health interacts with Ministry of Finance. Okay, so all of these together are part of the health policy systems research. But previously, a lot of people thought that only micro and meso level topics are related to health systems research. But when this field evolved, we realized that there are macro level issues too. And where I work in Singapore, still this idea is predominant. They talk about delivery science, improvement science, operational science, implementation science. I myself do implementation science. I, in fact, lead the program evaluation implementation science unit, which is part of the health systems research, but it's a tiny part of it. Management science. So a lot of people actually used to think that, okay, managing a hospital is health systems research, but it is not. It's just one tiny part of the health systems research, but there are other issues, macro level issues, broader, bigger issues related to health systems research. So health system, we talked a lot about health system, we talked a lot about health policy, but what is health system? What is health policy? Health systems means all organizations, people, and actions whose primary intent is to promote, restore, and maintain health. Okay, and there are many such frameworks which help you to understand the health systems. Okay, there is a framework called Control Knob, WHO building block, which I believe many of you already know about. There is systems thinking framework. There is dynamics framework. There are many frameworks actually. In this slide, you can see a study done by a colleague, Josephine van Wolman. She is originally from Netherlands, a good colleague of mine, a senior like a senior sister to me. She's current. She's she recently came to Singapore. Actually, she became a professor in Yongloo Lin School of Medicine. They're developing a health systems department within School of Medicine. So they hired her. So she is in Singapore. But this is her paper. Okay, very good paper. I mean, if you're interested in health systems and different frameworks, you see how these frameworks actually evolved over the time. This is 1980s. So the actors framework, infrastructure framework, then there is a Romer model framework. This is 1990s, 90s, 2000, when WHO came up with its first original framework in 2000. World Bank came up with this control knob framework. Then around after 2005, we have this 6 building blocks framework, which many of you already know. But there are other frameworks too. This is the systems thinking framework. This is the dynamics, health system dynamics framework. Then this is the investment framework from Shakarishvili. So there are many other frameworks. So the message here is that many of you who might have Googled health systems may think that, okay, health systems is about 6 building blocks. That's all. No, it's not. This is just one of the maybe hundreds of frameworks. But there are many other ways you can try to understand health systems. Okay, let's move on. Move on to health policy. We talked about health systems. Now let's talk to health policy. Health policy means actions and inactions that affects institutions, organizations, services, and funding of health and healthcare system. So why did I emphasize on the inaction? Because a lot of times when we talk about policy, we focus too much on the actions, and often we forget that there are certain things that should happen but are not happening. That's also about policy, and as a policy analyst, you need to look at those tricky areas too. Okay, so inaction is also important. So suppose something should happen, for example, Bangladesh health financing, for example, it should get more money, but it's not getting the money. Why it is not getting the money? For example, there is a salt policy in Bangladesh, but it doesn't mention anything about health. It's all about how can you increase the production of salt, how can you sell the salt, and all sorts of things. But it doesn't mention anything about health. So it's also something that omitted from the policy. Well, salt intake has a massive impact on our health. Massive impact. Almost all the countries have health-related issues in their salt policy. Bangladesh doesn't. I mean, unless they reviewed it very recently, but it didn't have a few years ago. So it's inaction. It's an example of an inaction. Now, as health policy and systems researchers, we do policy analysis. We try to understand the factors influencing why and how policies are initiated, developed, negotiated, communicated, implemented, and also evaluated. These are all the things that we do as part of health policy and systems research. Just like health systems, there are policy analysis frameworks too. Walt and Gilson's policy analysis triangle, which is the most commonly used framework. I used it to analyze the rural retention policy for the physicians in Bangladesh, and that came up actually recently. A lot of, many of my colleagues, friends, and even students are part of the current health sector reform commission. I mean, one student, not many students. And they're taking forward a lot of things that I did as part of my policy analysis. For example, I said that there should be 3 different tracks for BCS health service. One is the health service track. One is the administration and public health track, and there should be a medical education track, and they should have very separate management structure and their own mechanism for career development. But currently, it's not really properly designed. There is kind of overlapping, and it's porous. People are taken from one track. There are some tracks, but these tracks are not very formally structured. But anyways, that was part of my policy analysis that I did using the policy analysis triangle framework. I discussed about in this triangle there are actors. So who are the actors? Who are the players? We try to understand the processes, okay, how things happen, and we try to understand the context within which all these policies take shape, the history, the politics, and all sorts of things. Okay, and it's an interesting paper. I mean, if you have interest and if you have time, you can actually read. You can just write policy analysis, rural retention, Tawfiq Juhardar. I hope it will pop up. There are other frameworks too. Kingdom's multiple streams framework, which essentially says that there are three streams. Okay, there are three different streams which actually run independently or parallelly. But when these three streams come together, converge on a point, a window of opportunity opens. What are these three streams? One is the problem stream. The second one is the policy stream, and the third one is the politics stream. So what does it actually say? It says that when there is a problem, we need to have a solution, a policy solution to this problem. But only having a problem and a solution to that problem will not solve the problem unless the politics intersects with that, and that's very much visible with the interim government that we have. Why so much change is happening? Why? We knew that Bangladesh has had this crisis. For example, we had the crisis of human resources, we had the crisis of health financing, we had the crisis of I don't know what. I mean, you name it, hundreds of problems. But why now there is so much drive, so much pressure to change? We all had this research for maybe 20 years back, but now there are changes. Now my student is talking in a reform commission. Why? Because there is a political change. So that's what Kingdom's multiple stream actually tries to say. There are other frameworks too. I can't go one. Maybe there are a few hundred such frameworks, but these are the most common ones. I told you about the levels of operation of the health policy and systems research. It can happen at the macro level, like architecture and oversight. It can work in the meso level. That's the functioning of the organization, such as Ministry of Health, or you can actually do research on a hospital. You can do a research on an Upazila health complex, or you can do a research on how district level health or a civil surgeon's office work and things like that. So these are the meso level, and there can be micro level, the individuals, something related to doctors. For example, what are the motivations of doctors? Why the people of Bangladesh actually beat up the doctors, for example? Why? What happens? What's the problem? Okay, what are the problems? What are the reasons? How can we change it? And there could be cross level too, something that kind of cuts across all these levels. So this diagram shows you the macro, meso, and micro level health policy and systems research. At the macro level, we have the global and national context, some things that are very much related to the national health, global health, etc. There could be issues related to the organization and the local level, the examples I gave, or it can be micro level individuals, for example, the policy makers or policy elites, health managers such as Upazila, UHNFP Upazila health and family planning officers, the service providers like the doctors or nurses. It can be related to the citizens too, the people, the patients, okay, how empowered they are, for example, to kind of hold the decision makers responsible. You can do research on that. I chose 3 examples for each macro, meso, and micro level research. So one example of the macro level research is done by Dina Balabanova from London School of Hygiene and Tropical Medicine. They did this study on some positive countries, positive deviant countries, the countries and states of India, because India is very large, so they took just few states or one state from India. They tried to understand why these countries are doing relatively better than many other countries, despite low cost, despite low expenditure. Okay, for example, our immunization rate is actually very praiseworthy. How did we succeed? Maybe our other things are very bad, but our immunization is very good, right? Nobody can deny that. Our family planning is quite good. So we had some good examples. How did we achieve that? Some of our program, our TB control, we started DOTS program, oral rehydration solution. I mean, it was revolutionized in Bangladesh and went to other countries. So there are some positive examples in Bangladesh, although we did not invest much on those topics. How did we do that? How did Thailand develop their public health system, or Ethiopia develop their community health workers? Kyrgyzstan or Tamil Nadu also did good despite low cost. So so you see, I mean, they're trying to understand the whole country as a whole. In fact, they're trying to understand multiple countries by linking up the processes over a long period. They're following these countries for a long period of time. They used multiple methods. They followed the trend of human resources. They followed the trend of the health financing in those countries. They talked with the policy makers, policy actors, and tried to understand the policy processes. So it's very broad. So that's why it's about macro level. It's countries and multiple countries as well. There is an example of meso-level research that I conducted under the leadership of Professor Ronald Labonte from Canada. So this research was on developing a comprehensive primary healthcare model for Bangladesh. So let me give you an example how we did that. This was actually my second public health project when I joined BRAC University. The first project was about food habit of university students. Basically, we try to understand the impact of globalization on their food culture. Then my second research was this one on developing a comprehensive primary healthcare model. So we identified two upazilas, one a good performing or high performing upazila, and one low performing upazila. Now you can ask me, how did you really understand which one is a high performing versus which one a low performing? So we actually use the secondary data or the existing data from MIS database, and we identified few indicators or few variables, clubbed them together, created an index of performance, and then we ranked them based on that index value. And the high performing upazila was Dhamrai upazila, and the low performing upazila was Mehendiganj upazila from Borishal district. Now, we did not assess all the upazilas. Data were not available at that time. It was 2009, 2010. I guess it was 2009. Yeah, it was 2009, many years ago. So the data were not as good as now. But whatever we could, and we basically compared maybe 20 or 30 upazilas in total, not many. And then we identified the best performing and the lowest performing one. And then we went to those upazilas. We interviewed the service providers, we interviewed the local leaders, we interviewed the people, we conducted observations, we did key informant interviews with the policymakers, decision makers, high officials, director of primary healthcare, and people like them. We conducted household survey to see how equitable the service utilization was in these two upazilas. We conducted participatory rapid appraisal methods in those areas. So we also applied multiple methods, trying to understand why high performer is performing well and low performer is not doing so well. Okay, what are the factors that made one of them a good performer versus the other a not so good performer? We found that leadership was actually a major issue, distance was a major issue, and there were many other things. I can't remember, it's actually from many years ago. So what can we actually learn from the high and low performers? So this is all about meso level health systems research, because it's about upazila, which is actually kind of an institution and a sub-unit of sub geographical unit. But my PhD was actually a micro level health systems research where I tried to understand and measure the responsiveness of physicians in rural Bangladesh. There were multiple publications from this paper actually. So we tried to understand what is responsiveness. I mean, what are the social actions that a physician should do with the patient, and whether those are being done properly or not, whether patients are actually receiving the responsive care from the service providers or not. So this is something we did. Not going into the detail, it's already late. Um, um, so basically, I interviewed them, observed them, and tried to understand what even they mean by responsiveness. And then I developed a psychometric scale, conducted a survey, and then measured the level of responsiveness. So what are the health policy and systems research topics? What are the topics that typically fall under HPSR? The topics can be related to financial and human resources. For example, community-based health financing, health insurance, human resource distribution at the district level, upazila level, or national level. The research can be on organization and the delivery of the health services, a hospital, for example, or Upazila Health Complex, for example. Okay, so how the community can be involved in the care delivery process, how equity, effectiveness, and efficiency can be ensured. What are the approaches to the organization of the health services, drug and diagnostic policies, etc. The research can be on governance, stewardship, and knowledge management. Okay. The governance and accountability, how accountable the Ministry of Health people are, how they actually decide about the purchases, why do they purchase things that don't even come to any use, they rot in the storeroom after many years. Why do they purchase all these things? Where is accountability, where is the transparency? Health information system, how does it work? How do we set the priorities? For example, if you want to buy vaccines, what vaccine will you buy? How will you make the priority? Okay, effective approaches for intersectoral engagement in health. You want to deliver nutrition services. Nutrition is not just about health, because it's about agriculture. It has connection with the local government and many other things. Women, gender issues, so many different things. How multiple sectors actually engage. What are the barriers? This could be a HPSR topic. One important aspect of health systems research is health systems strengthening. So everybody is interested in, I don't know what happened to this. Okay. For example, you can compare health systems research to disease-specific research. So I told you before 2000, year 2000, most of the research, most of the fundings were disease-specific. They gave money only for certain diseases, tuberculosis, malaria, dengue, or things like that. But now we are saying that, okay, no, you need to think of the health systems as a whole. So health systems strengthening means you strengthen the health system as a whole, not just one particular disease. Okay, so now this is a quiz time for you. Okay, I can't see you. I only see my whole screen. So please speak up. Just unmute yourself and give me the answer. No need to raise your hand because I can't see your hands. So for example, you have a constraint, a limitation, a problem. Okay, the problem is that weak planning and management. That's your problem. So weak planning and management. There is a problem with the weak planning and management in your I don't know, maybe Upazila Health Complex or Ministry of Health, wherever, doesn't matter. So a disease-specific response would be a continuous education and training workshops to develop skills in planning and management. Okay, so what do? You give them training. Okay, but what should be a health systems response? Do you have any idea? Any answers? Like what should be a health systems response to the problem of weak planning and management? Okay, the first one, I let me show you the answer. So, for example, there is a problem in the planning and management, and you are just giving them training and workshop. This is actually not a good strategy. Rather, you need to perhaps restructure your whole ministry, restructure your recruitment process, restructure the development funding, development of cadre, and how your managers actually work. So this is a health systems response. So you see, a disease specific response is very limited. There is a problem, you just give them a paracetamol, but the I mean, you just decrease the what's that called, the symptomatic treatment. Okay, but symptomatic treatment will not cure your disease. You need to cure the disease, you need to go to the heart of the problem, and that's about health systems research. Okay, so if there is a problem in the planning and management, maybe you need to improve, restructure your Ministry of Health. Okay, next constraint, next problem is lack of intersectoral action and partnership. So different sectors or different partners don't work properly. That's the problem. So a disease specific response would be creation of special disease focused cross sectoral committee and task force at national level. Okay, so suppose the nutrition is not working, so you create a committee on or a task force on nutrition. Okay, but what could be a health systems response? Can anyone answer?
Sir, maybe there can be some policy regarding how the department should be structured throughout the nation, and how
Mm-hmm.
much fund is necessary for each department, and going with that, okay.
Very good, very good.
MPR.
Mm-hmm. I think it's a good answer. What's your name?
My name is Pumti Adrita Bose.
Okay, fantastic, very good. Where do you study?
Sir, I am studying Masters in Public Health in North South University.
Very good. Well done. Good try. Very close. So yeah, you basically mentioned that you'd rather change the policy. Why this intersectoral action and partnership doesn't work, for example, right? That's a good answer. There could be other answers too. For example, building a system of local government that incorporate representatives from the health, education, and agriculture and promote accountability of local governance structure and the people. So again, it's basically about changing the structure of the local government. So that could be one example of a health systems response. The third constraint, another example could be poor quality of care among the private sector providers. So the private hospitals are not providing good good services. Now you go ahead and train the private sector providers. So that's a disease specific response or narrow response. But what could be a health systems response to improve the quality of care in private sector? Okay.
There could be minimum quality standards which can be introduced for these private clinics, as well as public-private partnership shall be useful.
Very good. Excellent. What's your name?
My name is Fahim Ahmed Akhtar.
And where are you from? Which institution you're from?
I am from Pakistan. I am a graduate of University of Punjab.
Oh, okay. Fantastic. Very good. All right.
Yeah,
Yeah.
hello.
Mm-hmm.
Yeah, I want to add something there also.
Mm-hmm.
I
Sure,
think
sure, sure.
reviewing the training curriculum of the private sector service providers and try to tailor it to match up with the trend of the current training programs, that can provide better health service.
Yep. Yep. That could be one option too. Well, what's your name, and could you introduce yourself very briefly?
I'm Swali Hoshari from Sierra Leone, West Africa.
Mhm. Very good. And where are
A
you
public,
working
a-
or studying?
I'm currently working with the Ministry of Health at district level, which is subnational.
Mhm.
I've just completed my master's in public health with Kabah University in Sierra Leone. Yeah.
Fantastic. Very good. Okay. So the example that I took is development of accreditation and regulation system. So instead of training them one by one, why don't you develop an accreditation and regulation system? Okay. and that takes care of everything. That, because I mean, how many people you will train one by one? You just develop a training course, you train it, a new hospital is established, they are not trained, you again develop a training program. It cannot really, I mean, you cannot keep up with this. Maybe your hospital will develop, but the whole country will not. That's why you need to develop an accreditation and regulation system. Okay, so I mean, you don't need to get all these answers correct, but what you need to understand is that your thought process should be broad, and you need to actually think from a systems perspective, not a very narrow disease or specific areas perspective. That's the important message here. Okay, if you want to do health systems research, you need to take into account a few methodological consideration. I'll talk for maybe a 10 or 15 more minutes, okay? 10 minutes perhaps, and then we can talk for 10 minutes, take questions or discuss a little bit, okay? Otherwise it becomes too didactic. I can actually continue for a long time, but yeah, we need to draw a line somewhere. So the research should be applied. It starts with a topic or a problem. It's not about a particular discipline. So sometimes the anthropologists just do research on their particular field or particular discipline, while health policy and systems research people, they don't think about the research. I mean, the discipline. They don't think whether it's an anthropological research, is it's a geographical research or whatever, a mathematical research, I don't know, you name it. Okay, what we are interested in is the problem and how we can solve the problem. And based on that, we go to this. And if I need one, I will hire an anthropologist or hire a statistician to work with me. It's a multidisciplinary, it's an interdisciplinary anyway, right? So it's not about, it's very applied. It's a real world versus laboratory based, and it's very much policy relevant. So you want to work, it needs to have some relevance to the policy. You should not do a health policy and systems research which doesn't have a policy relevance. It must consider complexity. You need to understand that there are many things that you cannot control. It's not a randomized control trial where you give a specific dose of something in a very controlled environment. Health systems research or health policy research doesn't work like that. If somebody expects you to do something like that, I mean, that person needs to change their mindset. There are numerous interacting elements, okay? And these elements actually change and interact with one another. There are different actors with different experiences and different questions. For example, a manager may have a different perspective, a doctor may have a different perspective, a patient may have a totally different perspective. While the patient's relatives may have a different perspective, okay, who are common citizens, okay. Social phenomena are important. There are cultural issues, interest group, leadership issues, and there are contextual influences. So you need to consider the context. This is very, very relevant. I mean, we are seeing this reform related discussion in Bangladesh a lot, but many of these are not really contextually relevant. People always want to make massive changes, but we often forget that change requires time and there are contextual issues. People behave in a certain way because there are reasons they do that. And you need to understand that and have sympathy and deep understanding and then try to change it over time. So this is very much, I mean, I'm talking about Bangladesh politics, but it is very relevant for Bangladesh health systems too. And I usually see, I mean, I have lectures where I clarify why politics is so much ingrained in health systems, why health is so much a political phenomenon actually, because they have a lot of similarity, just like this, okay? Now, this is actually a causal loop diagram, an example of the complexity. There are some research methods where you can actually capture the complexity. So this is just an example of causal loop diagram on immunization, how different actors work, how one initiative can have a positive or negative impact on something, and it kind of works like that. You you try to do something good, but it will have a negative effect on something else, and it kind of is very messy. There is no single methodological gold standard in health policy and systems research, such as randomized control trial. People say that randomized control trial in epidemiology is kind of the gold standard, but in health systems research or policy research, there is no gold standard. Okay, there are a range of study designs or research strategies depending on the purpose and the research question. You can apply cross-sectional studies, longitudinal, experimental, case study, ethnography, action research, whatever makes sense. And there are ranges of epistemologies or the philosophies. It's not limited to one particular philosophical or epistemological underpinning. It has, I mean, you can apply positivism, you can apply relativism, and most likely you will do some realist research too. Now, the question is, what makes a good health policy and systems research question? Okay, so the question can vary. It can have different types. It can be of different epistemological background. But the thing is, what makes them a good question? So your research question, when you're thinking about it, it should be substantively relevant. That is, it should be worthwhile. You should not do research, or at least health policy and systems research, just for the sake of doing it. It must be worthwhile. It should be non-trivial. That is, it's broad, it's important, okay? Worthy of the effort to be expended. Plus, it should be clear. Your research question should be clear, unambiguous, and easily understandable. Some people actually write such a long research question that I get confused what this person is trying to say. Okay, the research question should be specific, sufficiently specific to be clear about what constitutes an answer. So you need to understand what is actually an answer. I mean, you don't need to know the answer, but you should know what constitutes an answer. It should be answerable also. We should see what data are needed to answer it and how those data will be collected. Okay, so you should have a very clear methodological thought in your mind, like this is what I'm going to do to get this data, and this is where I can get the data from. And also it needs to be interconnected. Questions are related in some meaningful way, forming a coherent whole, because there could be multiple specific research question to answer a broad general research question, and these specific research questions should be interconnected. The research questions should be broad, beyond the disease and treatment of focus, should be up above the program or service to the facility or district or a hospital. They are about the cross-cutting functions that underlie the service and the program delivery, the system building blocks and interactions among them. So a good health policy, I mean, I'm sure you cannot, I mean, all your questions cannot be so broad and you cannot satisfy all of these, but this is a common kind of, what should I say, like the characteristic that you should strive for, or you should aim for, you know. There are some ethical challenges. I'll gloss over it because we are running short of time. There are ethical challenges in health policy and systems research. So suppose you saw an unethical practice. Let me give you an example. I have so many stories actually. When I was doing my master's thesis in an Upazila health complex, there was an interesting, I mean, it was not part of my research, but I just realized, I mean, I just discovered it. There was a program called demand-side financing. What does it mean? It means the government actually introduced a program, a project where if a pregnant mother delivers in a hospital in an Upazila health complex, the mother gets money, a certain amount of money. It's not just about for the not just for the mother. The doctor also gets some money, and the nurse also gets the money. Now, the problem is, I mean, the doctors and the nurses do not stay there for time. Only the nurse who delivered gets the money, or the nurse or the midwife who was there during the delivery time gets the money. So what happened is that when the patient comes, the nurse wants this money, so she pushes oxytocin IV. So oxytocin should, I mean, it creates a contraction of the uterine contraction, and the delivery happens very quickly, but it's very, very dangerous. There could be rupture, there could be other complications, and it should not be given unnecessarily, and it should not be given in a in IV dose. It should be given in drips so that the contraction happens little by little. Okay, but the midwives, there was no midwife back then. It was 2008. The nurses wanted this money, so they did this unethical practice. Now, I am a researcher there. Okay, I'm not supposed to tell anyone about what I see because it's confidential. So should I just allow the patients to suffer? Should I protest it? Should I stop this practice? Should I report this person to her manager? What should I do? This is an ethical dilemma, right? That I firsthand experienced. How to present findings in ways that balance confidentiality, give voice to those not usually heard. So in my other research that I described, I talked with villagers about the services. Now, I gave them the voice, I allowed them to talk, but that can also endanger their service receiving. So suppose they talked about a very corrupt doctor, an Upazila UHNFPO, but what if the UHNFPO learns about this community and does something bad with them? Suppose they did not give, I mean, perhaps he would not send a health assistant to that area or something like that. I don't know. But bad things can happen. People can have grudges on them. How to act in ways that have potential to stimulate change in unequal relation and rather than exacerbate unequal relationships between people. So how can we, so suppose when I go to interview, for example, I'm a doctor. When I go to interview a village doctor, there is a power dynamics between me. So how can I diminish this power dynamics? How can I decrease this unequal relationship? Okay, I don't know. I mean, if I want to do that, that can actually have some consequences. I may not get the right data. So there are many such ethical challenges in health policy and systems research, and that's why you need to adhere to certain ethical principles to follow. You need to collaborate with your partners. Your research should have a social value, not just scientific value. But at the same time, there should be scientific validity. That means your research should be very well designed. It's not, it shouldn't be a willy-nilly research. You know, it should be scientifically valid. Fair selection of a study population. You cannot select one group of population at the cost of another group of people and put them in risk. Favorable risk-benefit ratio. If you benefit from a certain group of people, you need to return the favor that you get from them. There should be some sort of independent review of your research so that your research is good, your data are proper. There should be the issue of informed consent, and you need to respect the participants' decisions. For example, if at some certain point they say, okay, I don't want to participate in this research, they can actually stop and you should not do anything. There could be other issues. Who determines the question, for example? We are saying so much about the power and all sorts of things, but do the people of a village really have the power to decide what research is important to them? Who determines the questions? How can you gain consent when there is a power relationship? Okay, so suppose you go to a rural or Upazila Health Complex. You're coming from Dhaka, you belong to a university. I mean, you can ask for consent, you can seek consent, but do you think they will ever say no? Because there is I mean, even if they don't want to talk to you. Anonymity, there is issue of anonymity. You're doing an observation. How can you maintain the anonymity? You cannot, because you're seeing them, you're recording them, so many things. There could be issue of small sample sizes. Perhaps you're doing research on something where you don't get a sample size, a statistically justifiable sample size. It may not be there at all. Okay, acting ethically toward the field workers. Oftentimes, we ask the community health workers to collect the data, or the field workers collect data for us. They're already overburdened and underpaid, and now you're giving them more tasks to do. Is it ethically right? Recognizing the researcher's privilege and power. I gave this example before too. You have certain privileges and power. You belong to a university, you belong to the Ministry of Health, you're going to the village. I mean, there are issues of power. I mean, how can you get the data? Um, I mean, maybe you cannot change it, but at least you need to recognize this power differential in your paper. And also, there should be the issue of generating social value from substantive relevance to where does the researcher's role end? Should you, I mean, what is your role really? I mean, make, should you change the system? Should you develop an intervention? Or your role is only to collect data and publish a paper? Okay, so these are some of the pertinent issues that commonly pop up in health policy and systems research, and we don't have a right answer to any of these. Thank you for your patience, and I stop here.
Thank you so much, Dr. George sir, for that enlightening session. Now, we would like to open the floor for any questions or comments from our honorable participants. If you have a question, feel free to raise your hand and unmute yourself. We would be happy to hear from you too.
Thanks for the nice and elaborative presentation. Should I go?
Yeah, please.
Okay. I'm Munmun. I'm actually a government physician, but now I'm a student. Now I'm in student in Yonsei University, South Korea. So I was like my thesis topic, I was interested on working on the health policy issues. So when I go through the health in all policies issues, I'm a little bit thinking about these issues. How can government effectively develop such an integrated policy in all sectors? So WHO has some criteria, and also GE, they have some 11 sector of health policies. So you said about in your presentation also that nothing is actually model is here, but country like our countries, Bangladesh, they should have like health in all policies. Like you also mentioned that about the salt. So what are the actually the process we can go through for our Bangladesh? As I'm also interested about to going back home, I wanted to actually work with the policy issues. Thank you.
I think, I mean, it will be unfair for me to answer in maybe 1 minute to this very, very important question that's related to your PhD program. It requires days, months, and even sometimes multiple months of deliberations to really decide your research question and the methods that you need or the frameworks you need to apply. Okay, so my answer would be to talk to your supervisor and work with him or her on how to do it best. But on top of my head, I could say that I think you are in the right track. Either the WHO framework or the other framework that you said, it's important to identify the stakeholders who are relevant for it and talk to them, interview them, and analyze your data based on this framework. So what are the things that are hindering these policies in all, what was that called? The health in all policies thing. What are the
Yes,
barriers?
yes.
You interview
Mhm.
them, you try to understand their perspective based on these frameworks or the constructs that are used in this framework. I can't remember. I might have seen this framework, but I can't remember what was there. But you can actually interview them. Key informant interview is important. You can do, for example, network analysis, social network analysis. Very, very important, very useful. Like whether these people actually talk to each other. Who do they actually talk to? Okay, is there any particular body which kind of connects them or connect them? Okay, so social network analysis could be another thing. Qualitative key informant interview could be another thing. So these are some of the methods, or these are some of the approaches that come to my mind. I think you should also do position mapping or stakeholder analysis, like who has the power and who opposes these things, who is in favor of these things. So this type of analysis is called position mapping or power mapping or stakeholder analysis, this type of things. These are, I mean, just very rapid and what should I say, like very brief um, idea on your research. But it's your research, you need to decide. Okay, I just shared some of my thoughts, which may not be optimum, but yeah, I mean, since you asked.
And thank you for your short but informative informations.
You're welcome.
Good night. I am Dr. Elahi Khondukar. Can you hear me?
Yes, I can hear you.
Thank you for your brilliant and insightful presentation. Could you enlighten us about how epistemological and ontological approach to help or to guide to health policy, or what are the distinction between epistemological and ontological approach?
Yeah, so you asked a very difficult question, but epistemology is theory of knowledge. I mean, how we actually understand knowledge. Okay, so some people say that it's not really the right place to discuss these things, and it's not a methodological course. It's about health policy and systems research. But regardless, since you asked, I should answer. So there are different epistemologies of knowledge, or different epistemologies to understand the reality. Some people say that we can never understand the reality because it's first it's complex, and also it's highly variable. That's why they rely on qualitative research to understand the perspectives, and they don't ever claim that it's statistically generalizable. Okay, that's basically I mean, relativist approach, or relativist epistemology. On the other hand, the positivists say that, okay, if you have a proper method, you can always reach, I mean, even if you don't have the right tool, perhaps you don't have the right tool to measure it, but methodologically, if you had the right tool, you could always measure the right answer. But this approach is now obsolete because the post-positivists, I mean, this 95% confidence interval, because the post-positivists say that even if you collect data, however data you collect, the next data actually can change your answer. So we always say everything in terms of a 95% confidence interval. That is, you are kind of 95% sure that you can basically get the answer. On the other hand, the realists, or pragmatists like us, we say that, okay, we don't care about epistemology much, but we are interested about whether, I mean, we don't want to go into the debate. As long as our work is beneficial, we are happy with that. And most of our health policy and systems research, not all, but a lot of it is actually pragmatic approach. So that's basically what we learned. But ontology, I don't want to go into that. I forgot. I read maybe 20 years ago. So, but yeah, I mean,
It's okay. Thank you. Thank you for your insightful answer. Okay. Thank you.
Yeah, Sabrin, you can ask your question.
Thank you so much. Hello. Thank you so much for the fantastic presentation. I have two questions. Would you like me to ask both questions or one by one?
You can ask both, especially if they're related, but otherwise, yeah.
A little bit. Yeah. So my first question is, how important do you think it is for policy researchers to have prior field experience or direct contact with the population, either through research or practice work? So in you, how important would that influence the quality of the policy recommendations?
Let me answer this. I mean, answer is very, very simple and very short. It's very, very important. As I said, it's a very practical field, and for that, it's very important that you go to the field and you know the context. You interact with people a lot.
Yeah. Great. And my second question is, what is one or two key pieces of advice that you would offer for writing policy briefs that are well
Okay.
received and
Okay.
strong impact? So currently, I'm doing an
Okay.
action-oriented research for my PhD
Mhm.
on contraception in Algeria, and a piece of like the deliverables would be a policy brief. So I would appreciate your
Okay.
advice.
All right. Very in very short. There are good resources on policy briefs. You can try. I guess SIDA has some good resources, and other organizations have some resources too. But in general, I mean, if you want me to tell you just one thing, that is, don't try to express how knowledgeable you are in a policy brief. Rather, try to be communicative. So, policy brief ideally should be a very easy to read, both in terms of language and also in terms of like the graphs or other visuals that you use. So make it easy. This is not the place to show your aptitude or your knowledge or anything like that. It's a communication tool. It's not really a scholarly tool. So the more effective you are in your communication, more effective you're in communicating your finding, the better. So that's it. And don't make it too long. A lot of people actually, I mean, I don't see much difference between a research paper and the policy brief. Policy brief should be maybe 4 pages max, and should have some good visuals. Easy, very easy. And it should definitely have the policy focus, what exactly you want the policymakers to do.
Great. Thank you so much.
Welcome. Yeah, I see a few more hands. Please go ahead and ask.
You can go ahead.
Yeah, sure. Yeah, please go ahead, Pongti.
Sir, can you hear me?
Yeah, I can hear you.
Sir, I had more of a generalized question. Forgive me if it's too naive. But as a prospective researcher in health system or in public health, I would like to have your insight on the fact that, as you have mentioned, that health is inherently political, and so all the policies regarding it are also very much political inherently. So when as a researcher, I feel that it is our duty to scientifically present the statistics about the health system to the general people. But once I had an idea that I wanted to do a research on how much money is exported from how much money is spent on a health system or the genetic marker test. As I am a biotech graduate, so I was interested in this, that genetic tests are not quite available in Bangladesh, and for that and for advanced cancer researches or treatment, we are dependent mostly on the other countries, be it India, be it Singapore or Thailand. But if you want to calculate the wasted money or the exported money, if the data are not available, be it for the confidential issues or ethical issues or whatever. So as a researcher or a student, how can we navigate through these issues when the data are not available due to political or ethical reasons, whatever it is?
Again, I really don't have an answer to this question, but I think, I mean, when we have such issues, usually an advocacy is the answer. You try convincing them, and while you are trying to advocate, you need to make some allies. You need to have some good evidence from maybe a different country and tell that this is what happened in a different country and they were benefited. So yeah, I mean, maybe you should do some advocacy. You should find some allies who share the similar values and similar concerns and have the similar understanding, and then convey it to the people who can make the decisions for you, if it is really worthy of doing that. So that's kind of in short. I can't tell exactly what you can do, but in
Also,
general.
is there any secondary database that I can use for this research or anything?
Okay.
I actually searched, but there was nothing. All the data were predictive, not the original or exact data.
Look. I mean, don't take me for an encyclopedia of knowledge. I don't know about all the databases and all the fields and everything. So I can't really tell you exactly where you can find data for a field which is actually not even my field. So so I really don't know that. But yeah, I mean broadly I can tell that you should actually do more search. There are some search options only for databases. um I should. I don't know how to do it. Maybe my wife can actually could answer you better, because she does. She recently completed her second master's in precision medicine, which is related to genetics and use of AI in medicine and things like that. So yeah, she may know some good databases, but yeah, I usually search in PubMed and other such places. And our data, I know about my field, but I cannot tell you exactly where you can find, for example, the genetic data and other things like that.
Sir, I was actually asking about the money data, about the money and other data.
Oh,
Is
okay.
there any secondary database, because there is ethical concerns?
I really don't know. I mean, you can
Okay,
try
sir. Yes, sir, no problem.
you can try WHO WHO Global Health Observatory, which usually has data. So your question is, I mean, if I get you correctly, so you're talking about genetic diseases, right?
So I am talking about the money spent in other countries from Bangladesh on the genetic tests that
Oh,
could be
okay.
spent in
So
our country if the system was supportive.
yeah. So yeah, I don't think you have data for that actually. I mean, I don't think you have any data on that. Most probably you need to do a primary research for that. I don't know. I mean, some hospitals or private hospitals, I don't think. I really don't know. But you can try Health Economics Unit, because they sometimes do this type of work. Health Economics Unit under Ministry of Health. They may have some data. You can actually go to their website and write to them. If you want, I can connect you with people too. But yeah, I mean, that's the only place that comes to my mind who may have
Okay,
this
sir.
health
Thank you.
expenditure
Thank you
data.
so much.
Yeah.
Thank you so much. I will reach out if
Okay.
I need.
Yeah,
Thank
sure.
you.
Sure. Welcome.
As we are running a bit short on time, we'll be able to take just one or two more questions before we wrap up. So, if you have something in mind, please feel free to express yourself.
Hi, I don't have a question, but I have a comment. I'm Professor Mahesh
Sure.
Prasad. I'm connected to you. It was wonderful to listen to you. Past 1.5 hours just got spent without even realizing that we have been discussing so many important issues. I'm a very passionate learner, so I really enjoyed listening to all the insightful ideas that you had in store, and I'm sure you have a lot more to share with the community. And I'm also very confident that our young learners here have enjoyed the lecture and the session so far. It's been a wonderful discussion. I think this is a very important area of work which needs to be talked more, given the current climate that we are living in the world. These are very, very pressing issues that we are facing. And obviously, you started with a very basic overview, but you gradually took the whole audience along with you to talk about the issues, the ethical challenges, the different logistics challenges, and many other challenges that the field presents. So it was wonderful to listen to you, and
Thank you.
I think I really enjoyed. I don't know about what others felt. Hopefully, they'll give that in the feedback if there is any feedback link or something. But I'm sure they must have learned a great deal, because you are definitely a reservoir of knowledge. So you're being very humble and modest to say that you are not knowing everything. Obviously, nobody
Not at
knows
all.
that. Nobody knows that. But we are all learning. We are all evolving gradually. So it's wonderful to listen to you and learn some few things. Um, I think the future of Bangladesh is very bright, given that you are heading the Public Health Foundation of Bangladesh, being the vice chairman. So I look forward to future opportunities to interact with you on other platforms. And I'll give the mic back to other audience if anybody wants to ask any questions. And thanks, Rachel, and the team of BIIHR for inviting me to be participant of this particular lecture. Thank you.
Thank you so much. Thanks for your very kind words. I'm really honored. Thank you.
Good afternoon from my side. First of all, I want to say a very big thank you to the organizers of this webinar. A special thank you to Dr. or Professor Taufik. I do appreciate. You've done a marvelous work in terms of health system policy. I have learned a lot from these few minutes of session. So, like I've said earlier, I'm presently working with the Ministry of Health at district level, precisely on the community health workers program. I'm the district deputy focal for one of the districts here in Sierra Leone for all community health workers. Of recently, for the past 3 to 4 years now, or I would say close to 5 years, I've been working closely with the community health workers. From that time to now, I've really developed a lot of passion, a lot of interest in this particular aspect under public health, which is the community health workers. But there are issues currently. There is no policy that will be used to convince the state government for community health workers to be incorporated into the national health system, because it is very key as of now. Most of the organizations who have been funding the activities of the CHWs due to this US aid stuff have closed up. So currently we are facing series of constraints in terms of support, So I was thinking around, is it possible for a research to be conducted in that particular aspect? At the end of the day, that research document can be used to convince policymakers to see reasons why the incorporation of CHW activities into the national health system would be a good one. Or is it possible to start advocacy without such documents? So I really want to know between the two areas, which one I should really concentrate in terms of ensuring that community health workers program being accepted into the national health system. Thank you.
Yeah, of course, the research can be done. I mean, there are some very good, well-known researchers in the field of community health workers. I know Henry Perry was my teacher at Johns Hopkins. He does a lot of research. Maybe you can look up some of his work on the community health workers. I'm sure there are many others, Jill Oliver and many others. Of course, I mean, I think this should be, I mean, especially in USAID funding, they should be integrated within the the national health system. And I mean, there is no alternative to increasing the national spending on health issues in the current situation. Actually, it's for research, for implementation, for everything. So your question, I mean, if I understand correctly, if you want to do research on the benefits of integrating them in the national system, or what? But anyways, I mean, I'll let you speak. But I think a low-hanging fruit could be to look at some of the scoping reviews. There could be scoping reviews on integrating them in the national services and the pros and cons and things like that. If it is there, then it's easier for you to advocate for what you are trying to do, and you can advocate it with your seniors, So that's easier. But I'll let you know, I mean, if I understand and understood your question correctly.
Yes, sir. Thank you very much. Yeah, that was my question.
Yeah. So I would say, I mean, in the current funding scenario, doing a primary research itself is very difficult. So if there is existing evidence, I would say take advantage of that. and you can just search in Google Scholar with relevant keywords and see if something pops up. But I think you may find something relevant and useful. Yeah. So it's quite late for me. It's already 12 a.m. I mean 10 minutes to 12 a.m. So if you allow me, I'd like to stop here.
Yes, sir. Thank you to everyone who asked questions and engaged in this discussion. And once again, our heartfelt gratitude to Dr. Taufik Jordar sir for being with us and sharing such valuable insights. That brings us to the end of today's session. We hope it was meaningful and thought provoking for all of you. Before we sign off, a quick announcement. We have another international free workshop coming up later this week titled The Power of Collaboration in Research Strategic Approaches for Emerging Researchers. We would love to see you there as well, so please stay tuned for the details. Also, a feedback post will be posted shared soon on our social media platforms. We would be appreciate it if you could take a moment to share your thoughts there. Until next time, take care, stay curious, and keep learning. Have a wonderful evening.
Thank
Thank
you.
you, everyone.
Bye.
So, assalamu alaikum.